Hi everyone, my name is Dennis and I'm an emergency room doctor. So I'm making this video in order to address vaccine mandates for young people. With the Omicron, what we are seeing is a very mild illness, especially in young people without any risk factors. What we're also seeing is exploding infections in highly vaccinated areas, such as New York City, for example, where they're seeing over 100,000 cases or 80,000 cases a day, which is an all time record, which includes the periods of time before we had any vaccines, which means that the virus is spreading at a pace, more rapid pace than it ever did, despite the vaccinations. So we have clear proof that the vaccines do not stop spread. We have clear proof. Now, we also have proof that they decrease the mortality or morbidity. So, in regards to vaccine policy now, how does this translate? So let's take, for example, a college student. His risk of a college student without any comorbidities, right? His risk of dying from COVID or being very sick from COVID is slim to none, right? So that college student has almost no risk from getting very sick from COVID, from utilizing hospital resources, or dying. But from what I'm hearing now, they're starting to be forced to take boosters now, which is I think unnecessary and probably falls into the realm of medical malpractice. And let me explain why. So we have proof that the vaccine does not stop transmission, right? And we also have proof that the young, healthy people are at super low risk from this. They do not get sick from it. So, why would you try to mandate a booster for a young person? It's not going to do anything for the community because it does not stop spread. And again, New York is an example. Why would you mandate it for them when they don't really need it? Because they're going to do just fine. Vast majority of them are going to do just fine. So they have no personal benefit from the vaccine, and there is no public benefit from the vaccine. So forcing people to take a medication that has no benefit from them or the public around them while taking that risk, because all vaccines have risk. It's a small risk, but they have a small risk, but it's an unnecessary risk for this patient population. Same goes for professional athletes. Take Kyrie Irving, for example. He's a NBA player that can't play in New York because he's not vaccinated. In the same place where you're having almost, 80, 90,000 infections per day, many of whom are vaccinated because New York is a highly vaccinated region, approaching 80%. So why are we taking away the rights of a person to perform, do their job or go to school for no reason? So this is a public policy that is misplaced. It is hurting a lot of people, and it needs to be adjusted. And that's just what I wanted to say about this, because this is actually affecting people's lives significantly and for no reason. Actually, doing this to people does constitute medical malpractice, in my opinion. That's it. All the vaccine mandates should be immediately stopped, given what we are seeing from the virus. People at risk should be taking these vaccines because they do decrease mortality and morbidity, but people who have low risk should be just left alone to do whatever they want. The country should be fully open.